Hi, I'm Dr. Abhinesh. I'm a consultant nephrologist and renal transplant physician from Kaliappa Renal Center and Bilroth Hospitals, Aripuram in Chennai. So I'm here to talk to you about how to prevent infections in dialysis patients. So let me start by talking to you of why it is important to prevent infection in a dialysis patient. Infection is a very important determinant of the prognosis of a dialysis patient. And any infection can cause a complication in a dialysis patient, and it can reduce the quality of life of a dialysis patient. It can also reduce the longevity of life of a dialysis patient. So prevention of infection is very, very important, very, very crucial, because dialysis patients are malnourished often and they are immunocompromised. Okay, so let me start by talking about the most common infection that is encountered, which is hepatitis B virus and hepatitis C virus. So these two viruses are the most common infections in dialysis patients. So how do they occur? They occur due to cross contamination. While the dialysis process or while washing of the dialyzer or the tubules, cross contamination spread from one patient to another. So what is the best way to prevent hepatitis B infection? The best way is vaccination, because you have a very effective vaccine for hepatitis B. You have a vaccine where a double dose is given, 4 doses are given over a period of 6 months. And that is very effective in preventing hepatitis B infection. For any infection, for the matter for any infection, if there is an effective vaccine, that is the best method to prevent that infection. So nowadays, hepatitis B vaccine is part of the vaccination regimen of even infants nowadays. So after completing the hepatitis B regimen, the 4 doses, to check the power of the vaccine, whether the vaccine has been effective or not, you can do a test called anti-HBs. So if the titer of anti-HBs is low, if the value is low, it means the vaccine effect is not good. You can always give a booster dose to boost the effect of the vaccine. So it is very effective in preventing hepatitis B infection. But unfortunately for hepatitis C, there is no vaccine. However, on the flip side, there's a fantastic treatment for hepatitis C. Over the past decade, you have got new drugs for hepatitis C. You have to take a 3-month course, and it can cure the infection very easily. Okay, so what are the other ways to prevent hepatitis B and hepatitis C infection? One way would be to use a disposable dialyzer. Because reuse of dialyzer, there's a risk of contamination, cross-contamination during washing of the dialyzer. So you can, if feasible, if affordable, you can use a disposable dialyzer. And rarely some units reuse the tubules used for dialysis. Most units do not, but rarely some units do reuse. So you can request your unit to not to reuse the tubules in case they are using. But most units do not reuse the tubules. Then what you could do is you could be observant in the dialysis room, and you could request your dialysis nurse, and you can observe whether your dialysis nurse is using a hand rub to clean her hands before the dialysis process is started for you. And also you can just be observant and see whether they are using a separate glove for you. They must not use the same glove for multiple patients. So you can request them to use a separate glove for you. Apart from that, just make sure that the syringe and the needles that are used for you, they are new and they are fresh, and they are not reused across multiple patients. And suppose a vial is open, heparin, for example, comes in a common vial. So suppose a vial is opened and the heparin is drawn from the vial using a needle. That needle has to be discarded. It should not be reused again to draw heparin from the same vial, because it can cause cross-contamination. So just make sure that the new needles and new syringes are used. So these are the best methods to prevent hepatitis B and hepatitis C infection. And also you can just verify with your unit. Some units, many units have a policy for screening for hepatitis C and B virus amongst their patients. For instance, in our unit, we do hepatitis B and hepatitis C serology, ELISA for hepatitis B and C. We do it monthly. There are units which do it 3 monthly or 6 monthly. So just verify with your unit whether they have a protocol to screen patients, because it is very important to diagnose a patient early and isolate them into a separate unit. so that they do not infect others, due to cross contamination. So moving on. So moving on to the next type of infection which occurs commonly in dialysis patients, bloodstream infections, infections in the blood, which commonly occurs due to a dialysis catheter. So dialysis catheter is inserted in the neck or in the thigh, and it is quite prone for infection. So what is the best method to, how vaccination is the best method to prevent infection, hepatitis B infection? What is the best method to prevent infection, a catheter-related bloodstream infection? The best method is to avoid a catheter and go for a fistula early. Most patients, they are diagnosed early. They are diagnosed with a creatinine of 3 or 4 or 5 or 6. They are diagnosed before the dialysis stage. And when the creatinine is around 6 or 6.5, in our unit, we do the fistula and keep it ready. The problem with the fistula is dialysis cannot be started immediately. You need to give 6 weeks for the fistula to mature. So there's a lag period. So emergency dialysis cannot be done through a fistula. Emergency dialysis can be done only to a dialysis catheter. So in case you are a patient and you are diagnosed early, you are diagnosed before the dialysis stage, please do a fistula when the creatinine is around 6 or 6.5. That is very, very important. What I see is some subset of patients, they develop a fear. They are scared of doing a fistula, and sometimes they disappear when they are asked to do a fistula. And then they reappear with a very high creatinine of 14, 15, 20, and they come with breathing trouble. And that time we'll have to insert a dialysis catheter in the neck, and we have to do dialysis. So this could have been prevented if they had cooperated and if they had agreed to do a fistula when the creatinine was lower. See, so the most important step is to do a fistula when the creatinine is around 6 or 6.5. So apart from that, the other ways of preventing this bloodstream infections, it can also occur with a fistula, but fistula, the chance of infection is very less when compared to a dialysis catheter. Okay, so the next points I'm going to say, it is somewhat common between a dialysis catheter and a fistula. So just make sure that you wash your hands well with soap and water, and you wash your fistula site with soap and water before you come for a dialysis session. Okay, and also make sure that you use hand rub to clean your hands well before the start of a dialysis session. Make sure you wear a mask, because mask not only prevents respiratory infections like corona, but it can also, suppose you have to start a dialysis through the catheter, it also prevents germs from contaminating the germs from your mouth from contaminating the dialysis catheter. So it is important for you to wear a mask, especially during the start of dialysis, and preferably throughout the dialysis session. Okay, and this is from your side. And then just be observant in your dialysis unit, and just see, like I told you before, just observe whether your dialysis nurse is using a separate glove for you for your dialysis process, and whether whether he or she is using a hand rub, to clean her hands before the start of your dialysis, and also request them or verify whether they are wearing a mask before they start the dialysis for you. So these are some of the methods by which you can prevent the bloodstream infections. So next I'm going to talk about vaccination. I've already told you about hepatitis B vaccination, which is the best method to prevent hepatitis B infection. So what are the other vaccinations that we give in dialysis patients? We give the flu vaccine yearly in all dialysis patients, because the flu is quite a common infection and it can be severe in a dialysis patient because they are immunocompromised. So it is very important to take a flu vaccine every year. Apart from that, we give a vaccine for pneumonia. It is to prevent a specific type of pneumonia. And of course, nowadays we give a COVID vaccine. COVID vaccine is recommended in all dialysis patients. 2 doses plus a booster at least. So now moving on, I've also talked about general precautions like wearing a mask, using a hand rub, washing your fistula site, and then being observant in your unit and just verifying whether they are wearing a mask, they are using a hand rub before start of dialysis, they are wearing a separate glove for you and do not use the glove across patients. And then, so just be observant in your dialysis unit and just have a look and just see whether they are following precautions. If there's some lapse, please request them to follow the precaution. And last but not the least, the quality of water that is used in dialysis is very, very important to prevent infection. This is what This goes, in the background of a dialysis unit, where the water is undergoes a whole process of filtration, of purification. It goes through a sand filter, a carbon filter, and then the hard water is converted into a soft water. That is, it goes through a softener, and then it comes to an RO unit where it is purified, and then it comes into the it is connected into your dialysis machine, and then the dialysate is produced from that dialysis water. So a very good quality of water, a very clean water, is very, very important to prevent infection during dialysis. So each unit has a different policy, but just inquire whether your unit has a policy of monitoring the bacterial count or the enterotoxin count in the water. They do it screening. Most units, or mostly all the units, have a policy of screening, to look for bacterial contamination. So just ensure that your unit has a good policy to find out whether there is contamination of water. Okay, thank you.